Jane, thank you. Now, we've been talking this morning about drinking whilst pregnant. Well, drinking excessively could be made a criminal offence. There's a landmark legal case looking at the risk of alcohol exposure in the womb due to be heard at the Court of Appeal. So that could potentially bring about a change in the law. Let's talk to Dr Jan Macvarish, who's a parenting sociologist, and Dr Charlotte Kalia, who's a consultant obstetrician and gynaecologist. Ladies, morning to you both. This is a hugely controversial area, isn't it? Because it's how do you legislate or look towards sensible decisions for parenting whilst not infringing on that sort of whole big brother aspect of life. Charlotte, what are the current recommendations?
Well, the current recommendations from the Royal College of Obstetricians and Gynaecologists, the Department of Health and the National Institute of Clinical Excellence suggest that women should really abstain from drinking if they're trying to get pregnant, and particularly in the first 3 months. It's the safest probably to abstain altogether in pregnancy, but if you are going to drink, probably no more than 1 to 2 units once to twice a week.
Is part of the problem here, though, that there does seem to be mixed messages, because if you're looking at legislation which could make it a criminal offence, and yet we know, and the advice for a long time has been you can have 1 to 2 units a week, just be careful. There are these sort of mixed messages getting out there. Perhaps people are not really sure what they should be doing.
I think the evidence for heavy drinking is clear. There are very defined effects on the baby of heavy drinking, such as growth restriction, developmental behavioural abnormalities, effects on the fetal brain and facial development. The advice has been conflicting in the past about moderate to light drinking. It's also difficult to define what is a moderate and a light drinker. Certainly there seems to be no evidence of a harmful effect of light drinking, the drinking I described before, but I think moderate drinking should still be viewed with real caution.
Charlotte, it is, as someone who's had 2 kids, you are bombarded throughout pregnancy with all this advice about what you shouldn't do, what you shouldn't eat. As Charlotte was saying there, Jan, it is all right to drink a small amount, isn't it, for many women, if they're sensible? Do you think it should be a blanket ban?
Absolutely not. I think it's incredibly dangerous, and it's very dangerous for the parents of children with disabilities. The figures that you use there in the video are very, very dodgy figures, which have been produced by campaign groups, not from the Department of Health. So the claim was made that 1 in 100 babies born are affected by fetal alcohol syndrome. That's just not true. And I think it's really important that we start from a base of truth. If that was the case, 1 in 100 babies affected by fetal alcohol syndrome, that would mean that 2/3 of the babies born with disabilities in this country have those disabilities caused by their mother's drinking. Now, that is not true. It's dangerous. It's highly insulting for the mothers of those babies with disabilities, and it certainly doesn't help resources get to the children that need the resources.
Within all of this, I mean, isn't there an argument to say, you put a blanket ban down, it prevents problems. It is going to prevent some problems being, but it doesn't matter if it's 1% or 0.01%. If it safeguards babies, and prevents these fetal problems, that's got to be a good thing, hasn't it?
Well, it isn't clear, and it isn't helpful, because the consequences.
Well, why isn't it clear? If we know that moderate to excessive drinking causes
No, we don't.
these
We
problems.
know that with the children of alcoholics are at a higher risk of suffering from fetal alcohol syndrome. Lots of babies who are born to alcoholics won't suffer from this condition, so we know that it's rare and that it's complex.
Is Charlotte wrong then when she says moderate to heavy drinking is a problem?
She's saying that moderate drinking should be incorporated in the category of heavy drinking. I don't think that's the case. All the studies show that light to moderate drinking, 1 to 2 units a few times a week, is not harmful to the fetus.
No. But that's what Charlotte said as light drinking. We're talking moderate to heavy drinking.
The evidence is that light to moderate drinking has no evidence of harm. What we do know is that there is a condition that happens, over a 6-year period that the Department of Health gave us figures on. 987 babies with fetal alcohol syndrome were born. Now, that's a very, very rare, and it's very complex, and we don't quite know what the mechanism is between alcohol consumption and those disorders. So it's a huge step to make to then talk about all women who are pregnant or trying to get pregnant.
Charlotte?
I don't think there are any beneficial effects of alcohol in pregnancy. There is some evidence that moderate drinking has a dose-dependent relationship with causing preterm birth and lowering fetal growth gain during pregnancy. And I think those are important factors to take into consideration. There is a lot that isn't known about alcohol in pregnancy, but we do know that it is teratogenic for the fetus.
That seems, comparatively straightforward,
Well,
Jan. Why fight against that?
Well, except that other studies on light to moderate drinking have shown certain benefits to the child. Now, we don't know why this might be, and there's lots of other factors that explain or help to explain those kinds of associations. So before we start criminalising women, which is what we're talking about here, for behaviour that we have no idea, in fact we know that it's not harmful. We don't have huge numbers of babies being born with FAS, so why start with a problem that doesn't exist?
And obviously you two both know, the facts of your particular arguments very well, but to sit there, Jan, and say, with the greatest of respect to you, to say we know it is not dangerous, people watching, whether they're picked up halfway through this or not, this is where the confusion and the dangerous mixed messaging comes through.
But that's not a confusion, that's a stated fact. It's not a confusion. That should help people to not be worried.
It's all right, I can have a drink.
Yes,
I can have a drink.
They can.
But the medical experts are saying 1 to 2 units fine, which is, a pint of beer or 2 small glasses of wine, anything over that is potentially problematic.
But that can be that can make a big difference when in pregnancy, which is a stressful time. A lot of doctors will say actually 1 to 2 units. If you've had a bad week, a glass of wine at the end of the week if you're pregnant, you shouldn't beat yourself up about it. And it is right that isn't harmful, is it?
Yeah, that's true.
But you're fighting against the idea, Jan, aren't you, that actually what we might class as moderate drinking could be incorporated into the harmful element of this as well?
Yes, but we shouldn't incorporate it unless we've got evidence that it's harmful. I mean, why would you do that?
But why take the risk?
Well, because there isn't a risk unless we know there's a risk. So you're inventing a risk that we don't know
But that's
exists.
not true, is it? That's
Yes, it is
just
true.
Because we don't know there's a risk doesn't mean there isn't a risk.
Well, we could say that all kinds of things are risky, but if we don't know that they are, there's no point trying to do something about it. But when you're giving out advice which affects potentially people's lives, you've got to err on the side of caution, surely. Well, except that, what are the consequences of that? So, for example, in the States, pregnant women who don't stop drinking have been locked up during their pregnancy. Do we want to go down that route? Do we want to have people looking at women who have children with disabilities and saying, I know why that baby has a disability, it's because of what the mother did during pregnancy. Now, that is a disgusting thing to do.
Well, it is, but is this all about actually how we look at a blame culture or actually how we protect the next generation?
I think it's creating a blame culture which doesn't help anybody. It doesn't help children with disabilities, doesn't help pregnant women. It doesn't help any women or any parents because it just induces guilt and anxiety.
Pretty Charlotte, would you like more guidance? Would you like there to be a defined set of guidance that as a GP that you give to mums? Because at the moment it is slightly conflicting that it isn't necessarily black and white.
I think the Royal College of Obstetricians and Gynecologists have given quite clear guidance. I agree that fetal alcohol syndrome is quite rare, but there is a spectrum of disorders of alcohol-related problems for the fetus. And you can look at MRI studies of the fetal brain and you can see an effect of even moderate drinking on reducing the amount of white matter, which affects thinking, behavioural, cognitive processes in a child as they grow up. So I think there is evidence. Absence of evidence doesn't mean that something is safe. It really doesn't, and I think women should be given an informed choice, given the evidence there is, and given strong advice with other lifestyle behavioural advice. A lot of women who drink often smoke, they have poor nutrition, poor diet, and that needs to go hand in hand with advice about alcohol, I think.
Well,
it's a good moment.
A lot of strong advice from both sides of the argument on this. Thank you, ladies, very much indeed. Good to hear your views this morning. Stay with us here on Sunrise. Lots more still to come, including